All right, let's take the conversation further now. I'm being joined on the news at 10 by a senior medical practitioner and official of the National Association of Resident Doctors, Dr. Bayo Sekumade. Thank you so much for joining us on the news at 10.
You're welcome.
All right, we now have a new policy. What do you make of it? And is that what you think the health sector needs now?
Well, it's common knowledge that the health sector has been beset by a lot of challenges in recent time, and this latest revision has been long in coming. It's a welcome development, and one can assume that some of the challenges that have mitigated against the successful implementation of previous policy will be effectively addressed in the latest policy.
Now, when you say it's a welcome development, we've had 3 revisions in 1998, 2004, last year, this year. What's different about this new plan, if you welcome it the way you said?
Well, the document has now is not a public document yet, but gauging from the quality of professionals that were involved in the promulgation of the policy, one can expect that they would have done a very good job, and that's why we think it's a welcome development.
Yes, but what do you think is different about it? Even if it was worked on, as you say, there must be something that you find optimistic. What is different exactly?
Well, we have to maintain our optimism. Like I said earlier on, the problem with our system has always been about the implementation. I think there's a new focus now on addressing these challenges finally, and that's where my optimism springs from, that finally we actually be ready to tackle the issues head on.
Okay, let's look at the priority areas of the new plan. You heard the health minister there talk about primary health care as a priority. If you look as far back as 1998 and 2004, primary health care was also a priority, health for all from Nigerians. So why hasn't that been implemented then?
Well, it's a tough question because the problem is actually multifactorial. You find out that over the years, you probably want to point to the lack of political will to follow through on some of these policies. And for some time now, a lot has been said about the dwindling allocation to the health sector too. And so these are issues that we hope will be addressed when this new policy come on board.
What do you think is the most immediate need that the health sector needs right now? What should be, you said the plan is not a public document yet, but what should be top on that list?
Well, the most important thing as far as I'm concerned should be the commitment and the political will on part of the public officials to follow through on this document, because like I said, the issue has never been about formulation of good policy. The core issue has always centered on the will and commitment to follow through on these policies.
All right, Dr. Bayo Sekumade, thanks a lot for sharing your thoughts with us on the news at 10 tonight.